Hi, my name is Lori Little, and I'm going to be your instructor this spring for 4069 Health Assessment. This course is a lot of fun. It is building on what you already know as a professional nurse and just increasing your skills and maybe adding some new ones or bringing some ones out that you haven't used for a while and brushing up on those. So, looking forward to teaching that. It's a fun course to take. It is busy. You will be doing papers every week. I will do my best to keep up with those and give you some feedback and make sure that you know that you're doing well in the course. The kind of shining star, or the capstone, if you will, of the course is a video assessment, and that's kind of anxiety producing for a lot of students, but I want you to remember that you are already practicing nurses and that you know how to do an assessment. So what we're asking you to do is to do a focused assessment, and we will provide you a list of things that you need to have on the assessment, and you can do it more than once. So if you didn't like the way you did it the first time, you can do it again. You can either do it in the Cackle Lab here on campus at Tampa, or if you don't live here or it's more convenient for you, you can do it at home or in the hospital, wherever you'd like it to be. It's limited to 20 minutes. Need to make sure that you have everything on the list covered in your assessment, but you're able to have the list with you. So that assignment is the largest in number of points for the course. I believe it's around 60 points. But each week you will be doing different parts of the systems of the body, looking at those, talking about those, practicing some of your assessment skills. We will have a open assessment lab that you can sign up for if you're in the Tampa area and go down and get some hands-on experience with some of the instructors in the lab. And that will be, I believe, in March. So the course itself, like I said, it's a lot of fun. I think you'll enjoy it because you already are performing these techniques. It's always fun to add to them or to realize how you can use things and perfect them and make them better and use them as diagnostics for you as a nurse. So I think you'll enjoy the class. We enjoy teaching it. I did want to give you a little bit of background on myself, just so you know who you're working with. As you know, my name is Lori Little. I am from Kansas. Grew up in a very small farming community. Did not even have a stoplight. We did have a horse and lots of cows, but no stoplight. I went to Kansas City to receive my education, and I went to a diploma school. I'm not sure if you're familiar with what that is, but it is a 3-year program. It is, I believe, the original way that they trained nurses back when they used to staff the nurses with student nurses. I was one of those. So anyway, I was the second to the last graduating class of my school, which is now college. I'm dating myself here. It's 1983. I don't believe that there are any, I could be wrong, but I don't believe that there are any 3-year programs left in the United States. Most of you probably have graduated from 2-year programs. Those became extremely popular with the advent of the Vietnam War and the need to get nurses out more quickly, and also kind of dovetailed more easily with the baccalaureate movement. So the diploma was a little bit different and more difficult to kind of mix it into the university setting. So anyway, that's where I'm from. That's what I did, and I got my bachelor's in nursing in Kansas City at Webster University. I got married, and I followed my husband all over the country. I did receive my Master of Arts in nursing at the University of Iowa, and I apologize. While I was there, they were working on the NANDA and nursing diagnoses, so it was really a lot of fun. Not really. But obviously we're worthwhile and we understand the reason for it, but it was a rather painful process for those of us who were involved as a student. So anyway, that's where I went to college, and my clinical background and my interest in my graduate school were really one and the same. My clinical background is exclusively ICU and emergency trauma. CVICU is my home away from home. The open heart cardiac patient is my primary care patient. Although I do enjoy emergency medicine as well. So when I went to graduate school, I thought it made sense to go into adult gerontology since most of my patients were average age was 72. It's now 68, which doesn't speak well for us. But they did not agree with that and had to go a little bit before board. But I did get what I wanted. So I hold a degree as a clinical nurse specialist in acute care adult gerontology. I also have a certificate of aging studies. I am not currently certified as a clinical nurse specialist because they would have allowed me to take the adult gerontology exam, but because you had to work as a year before you could take the exam and there were no jobs, I never got certified. But that is where I hold my degree. I am also currently enrolled and pursuing my doctoral degree. I have 6 hours left, six classes left, plus my comps and dissertation. So please pray for me, and I will pray for you. So we're all going to be busy this semester. Like I said, this is a fun course. It's not terribly difficult. It gives you an opportunity to think through some of the situations that you have had and maybe different ways you could handle them and different ways that you could assess. And that's really the purpose of the course. So that's really about all I have to tell you about it. It's really a lot of fun. Most students really like it. Don't let the video frighten you. There is a rumor that goes around always that all of the nursing instructors are going to be in a AMC theater eating popcorn, laughing, watching people do their video, and that is absolutely not true. I will be the only one to see your video, and you can take it down as soon as you get a grade. So that's where that is. So I hope you enjoy the class. I'm looking forward to working with each of you, and I hope that you feel comfortable to call me. I've listed my hours. I take phone calls from 9 a.m. to 7:30 Monday through Friday, Saturday and Sunday by appointment 10 to 2. I certainly understand as a student myself that things can happen. God forbid, car accident, somebody's sick, baby's sick, and you can't turn your paper in on time. Leave me a message and let me know what happened, and we'll talk about that. The one thing that you need to be careful of, though, is that I'm required to take late fees if you have not contacted me. So it's 10% for the first week, and then after the first week, if you have not contacted me, it drops down to 50% penalty. So you can see how quickly that could affect your grade. So please communicate with me. My information on how to reach me best is on the syllabus. The phone is always the best. I'm an old woman. I don't accept text, and honestly, it's because I just don't do it very well. You can call my cell phone. You can call my office phone. You can email me. I do best through Canvas email because that's where I usually am grading and looking at papers, and so I see those first. I do monitor the USF mail, so I will check that, but you will get a faster response through Canvas. And I also like it because we can monitor our conversations between each other more easily that way. So that's the way I do it. And then, like I said, my expectation of you is just communicate. If you're having problems, if you're falling behind, and you feel like you're overwhelmed, give me a call. We'll work it out. We can find a way to make it work. So, I'm here to help you be successful, and I think you'll enjoy the class. Most students do. And if there's anything I can do for you, please don't hesitate to call. I work alone. I work at home. I'm a commuter. So I talk to myself a lot. So feel free to give me a call anytime you'd like. So as I said, my hours are listed on the syllabus, and you can reach me by email. So it shouldn't be hard to get since I work alone and there's nobody here. So I am getting a dog who I may talk to until you call me. So, well, I am a bit long-winded, so I hope you have a nice day. I hope you enjoy your course. One last thing I wanted to mention, please take 15 minutes. Just look at your course, read the syllabus, which you have to do anyway to sign in and do all of that. But really look at it and look and see how much work is involved so that you have the time set aside so that you can be as successful as you want to be. It's very easy to let this course run away from you if you're not careful, because there are assignments every week. So look very closely and see what it is that you need to do. And if you need assistance, if you need extra time, whatever, as long as you are communicating with me, we can usually work out a time frame. So with that, I will say good night, and I will look forward to meeting each and every one of you in course, and I certainly hope I hear from each of you. You have a nice night.